We begin tonight with continuing coverage of COVID-19 in Idaho. A big victory today in Idaho's battle against the pandemic.
Governor Brad Little announced today that statewide metrics justify returning to stage 3 of the Idaho Rebounds Plan.
Today, Idaho hospitals are still stressed for resources, but the majority are operating much more normally, thanks to the decline in COVID spread. Again, thanks to you.
But he warned the war isn't over yet and some restrictions remain in place. Gatherings should be limited to 50 or fewer people, but not for political and religious expressions, educational activities, and healthcare related events. Face coverings are strongly recommended and required for long-term care facilities. And bars, restaurants, and nightclubs should continue to operate with seating only. Still, health officials say it is only a matter of time before we discover a more contagious strain in Idaho.
Several of our neighboring states, in fact most of them, have already detected the variant strain. We have not the first variant strain, the B117, which was first detected in the United Kingdom. So we know that it is probably here. We haven't detected it yet. We do remain vigilant where our labs are looking for this strain, but we should behave as if it's here or it's on its way.
State epidemiologist Dr. Hahn goes on to say early indications show the COVID-19 vaccine will protect against variant strains.
And with the governor's declaration, the Gate City may be opening up a little more. Many bars and restaurants in the area are eager to open more to the public while also still meeting the health guidelines. Southeastern Idaho Public Health Director Maggie Mann believes the governor is evaluating the data when making his decisions. She says she is in support of the governor with recent case declines within her own health district.
Right now, the last couple of days, we've seen the lowest numbers that we have seen in 6 or 7 months. So we're very pleased about that and absolutely agree with and support the governor's new order.
Currently, SIPH is scheduling appointments for people age 65 and older for COVID-19 vaccinations. They have already filled 4,000 available appointments since yesterday. As more people become eligible to get one of those vaccinations, multiple agencies, including the FBI, Food and Drug Administration, and local hospitals, are warning about an increase in vaccine scams. Some of the tricks scammers will try are to get you to pay to get on a waiting list. You don't need to do that. Or they'll tell you for a fee, you can have a vaccine shipped directly to you. Well, that won't happen either. Right now, COVID-19 vaccinations are only being given out through Idaho's health districts and certain health care providers. You can find access to that truthful information on localnews8.com.
Well, COVID-19 cases and hospitalizations are dropping around the nation, but deaths still remain high, and there's growing fear about new variants of the virus spreading across the United States. ABC's Rena Roy has the latest.
The race to stay one step ahead of the rapidly evolving coronavirus is on.
Variants remain a great concern, and we continue to detect them in the United States.
The UK variant found in 32 states, the South Africa variant accounting for cases in 2 states, and the Brazilian variant in 1. South Africa now struggling with yet another mutation that's reinfecting people who already contracted the virus. Dr. Anthony Fauci telling the Washington Post vaccinations need to be happening faster, and drug makers should be prepared to upgrade vaccines if necessary.
It is concerning because it much more evades the protective effect of antibodies that are induced by the vaccine. Not enough to make the vaccines not effective, but it makes them less effective.
The White House now urging healthcare providers to not hold back second doses and also ramping up testing with new over-the-counter at-home rapid tests expected to be available soon. The U.S. is seeing a 40% drop in cases with almost 8% of the population vaccinated, but deaths are still high. Gwen and Mike Elbert of Tucson, Arizona were married for 53 years. They died from COVID-19 just 8 days apart before they were able to get their shots.
If we'd had that vaccination, just 4 or 6 weeks earlier, they would probably still be here with us.
In hard-hit London, 100-year-old World War II veteran Captain Sir Thomas More has died after testing positive for COVID-19 last week. He made headlines last year for walking in his backyard, raising millions of dollars for frontline healthcare workers fighting the pandemic.
Meantime, back here in the U.S., federal officials say starting this month, they'll be delivering doses directly to pharmacies in vulnerable communities to help increase vaccinations for those most at risk. Rena Roy, ABC News, San Francisco.